Dr. Terence Poon, welcome to Ageless by Rescue. What an honor it is to have you on the show today.
Thanks very much for the invitation.
Dr. Poon, we are going to talk about the most Googled search term for women over 30 in Australia, which is pigmentation, and how we can treat pigmentation safely and effectively. And I know that you are a specialist in this area, so that's why we have you on the show today. Can you start by explaining to us what is pigmentation?
In my experience, pigmentation is really one of the most common complaints, as you've said, that I see in my everyday dermatology practice. Pigmentation occurs in a wide range of people and in the population and very different skin types. Pigmentation can be due to an increase in the number of pigment cells in the skin called the melanocytes, or it can be due to an increased amount of melanin, which is the pigment which gives our skin its color. So pigmentation can be due to different factors. Pigmentation occurs when there is, as I said, too much pigment. So the pigment cells or the melanocytes are producing too much pigment, or the pigment is in the wrong place in the skin, in the layers of the skin, which can occur after a treatment or after sun exposure. And there can also be an increased number of what we call melanocytes, the pigment cells, from things like birthmarks and their genetic or inherited things. Melasma is a very common condition which we see, and typically it affects females or ladies more commonly than men. It's probably the most common cause of hyperpigmentation or facial pigmentation that I see. The pigmentation occurs in melasma generally on the face, and typically in areas such as the forehead, on the nose and on the cheeks. And melasma is due to a number of factors. We don't know exactly why it occurs, but it commonly occurs because of hormonal reasons. So typically in ladies who've been on the oral contraceptive pill for a long time, so many years, after some time, they can develop some pigmentation. We also see this very commonly in ladies who are pregnant. So it's known also as the mask of pregnancy and very common. Typically when we see melasma, I get told by my patients that they've been on holiday, or they've had some increased sun exposure, or they've had a sunburn when they've forgotten to put on their sunscreen, and the melasma or that facial hyperpigmentation occurs after that. People can get pigmentation of their face and of their neck and other areas for other reasons, and that pigmentation can be due mainly to sun exposure. So sun exposure causes a more uneven pigmentation in the face with things like freckles, or what we call lentigines, which are a little bit more easy to treat than, say, melasma, which can be a chronic or a problem which we tend to control or manage rather than necessarily cure. We use the Fraxel Laser because it has a wide variety of usefulness in pigmentation, in sun damage, and in also treating wrinkles and crepey skin. The advantage of using the Fraxel, we find, is that we can use that on people who've got darker skin types. So traditionally, when lasers first started, we used what were called ablative lasers. And these were lasers such as the carbon dioxide laser or the erbium YAG laser, which were lasers that took off layers of skin. But these particular lasers were limited in terms of who we could treat. So we could only treat patients who had lighter or fair skin types. And also with those treatments, because it's more invasive, there were higher risks of scarring. So with the invention of fractionated lasers, and in fact, it was the Fraxel company who invented this particular type of laser. It's what we call a fractionated laser resurfacing, where the laser works by sending down tiny little microscopic treatment zones, and that leaves areas of normal skin or sparing in between. And the advantage of that is that the treatments were safer. We were able to use these lasers on patients who've got darker skin types, and there was less downtime. So our patients found that they didn't have so much downtime. With the ablative treatments, people would look as though they'd been caught in a house fire for a week or 2 weeks, whereas with the fractionated lasers, we could actually reduce that to a number of days. There are a number of, I'm glad you asked that. There are a number of reasons why we love using the Fraxel here at Neutral Bay. One is that because Fraxel was the inventor of this particular technology, that they have such an extensive experience in terms of the number of treatments and number of patients who've been treated with this technology, that as we've refined our treatment parameters, we've been able to, we know that we can provide patients with a safe and effective treatment. So treatments have become safer, they've become more effective. The other advantage that we like with the Fraxel is that the way that the treatments actually occur, the handpiece that we use is actually a handpiece which lays down those treatment zones using a rolling technique. So the handpiece actually has a roller on it. Some of the other technologies or other companies use more what's called a stamping technique. So
yes, I've heard that.
You
Yeah.
can imagine stamping the laser treatment zones rather than rolling them. And the rolling, we find, allows us to provide patients with more even treatment, and we're also able to, because the face isn't flat, we've got areas like the nose, we're able to treat those areas and contours much more evenly than with a stamping procedure. I think we find that we get a good result wherever we treat. One of the things may be that we need to use slightly, for instance, on the neck and the décolletage, the skin there is actually more sensitive, or it's a finer type of skin compared to, say, the face. And what that means is that we do need to be a little bit more conservative with our settings that we use. And sometimes that means that we need to perform more treatments or multiple treatments on those areas, but we still get the same good result and good effect. But yes, we treat Fraxel all over the body. So yes, as I mentioned before, Fraxel technology has allowed us to treat a wider range of skin types. In terms of treatments, it's important that patients are assessed before they have their treatment to make sure that they're not on some particular medications. So typically, patients who've been on Roaccutane or isotretinoin for their acne, previously, one of the, I suppose, rules or things that we went by were that people couldn't have any laser treatment for a year after they'd finished their Roaccutane, because the skin wouldn't heal up as well. But a lot of that evidence or dogma sort of came from the time when we were doing full resurfacing, the ablative resurfacing, which I talked about before, yeah, with the carbon dioxide or the erbium YAG lasers. But these days, when we've got fractionated lasers, we can now treat acne patients, people with scarring. We wait 3 months, something like that, after they've completed their Roaccutane to start treating them, so they can get onto their scarring. We see a wide variety of patients. Obviously, that's a reflection of our multicultural Australia that we live in. And really, with the fractionated lasers, there's no restriction in terms of who you can treat in terms of skin type. So you can treat someone who's got the very fair skin, but you can also treat someone who's got the darker skin types.
How dark? How, Dr. Poon?
Look, And it also depends on which fractionated or Fraxel laser that you're using and whether you're using a superficial or a deeper wavelength. A lot of it comes down to, in terms of the settings that you use and being much more conservative or gentle with those darker skin types. Your main concern with them is developing that post-inflammatory hyperpigmentation, which we talked about before. So really, there's no restriction as long as you're very careful. If there is that post-inflammatory pigmentation, of course, that can be treated, but you know, it's a bit of a pain to get that. But yeah, so laser treatments in terms of fractionated resurfacing has been revolutionized by the fact that we've got this Fraxel and fractionated lasers now.
Well, I have got to say, I've had Fraxel and I've had all sorts of treatments, but this is one of the most in-depth and informative educational conversations I've had. And I can only imagine how lucky your patients are to have you treat them with the wealth of knowledge that you have. Thank you so much for debunking some of the myths and also some of the terminology around pigmentation. It is, you know, a serious skin issue for Australians, and it's wonderful to know that there are, you know, light, medium, and as you said, more spectacular options available to us to treat this skin concern.
Thanks very much, Bahar, and it's been a great pleasure to have a chat with you.